Mainly we have different types of principles is the main three principles, the principles of the common principles of the dialysis, it is diffusion, osmosis, ultrafiltration. This is the main three principles of the dialysis. Here the solute and water, it will be moved across the semi-permeable membrane from the blood to dialysate in accordance with the concentration of the gradients. For this we will be follow these three principles: diffusion, osmosis, ultrafiltration. Diffusion, we know that it is a movement of the solute from greater concentration to a lesser concentration. The movement of that is the purification of the things. It will be go from a concentration of high concentration to concentration of lower concentration. In kidney, it is mainly in kidney failure, a high urea concentration, urea, creatinine, uric acid, and electrolyte abnormalities like potassium and phosphate like things. It will be in here move from blood into the dialysate to the dialysate. So in the previous slide we have discussed that there are main three principles is the diffusion, osmosis, ultrafiltration. By using these three techniques we will be do the dialysis procedure. The main net effect of the dialysis, it is this three principle. The net effect of this principle, it is through this method we can able to reduce the waste product or waste content of the blood. Here the RBC, WBC plasma proteins are too large to diffuse through the pores of the membrane. Small molecular weight substance can pass from the dialysate into the patient blood. So the purity of the water used for dialysis is monitored and controlled. So the smaller molecular weight substance can easily pass from the dialysate into the patient blood. So the water used for the dialysis, it should be the purity that should be controlled and maintained. Otherwise there may be a chance of getting infection to the patient. Higher molecular weight substance may not be passed through the membrane. Another principle, it is osmosis. Osmosis is the movement of fluid from an area of lesser concentration to an area of a greater concentration. Osmosis means the fluid, it will be moved from lesser concentration to, that is small concentration, lesser concentration to the area of a high concentration. Here in the dialysis machine we will be add glucose for the dialysate to make this osmotic gradient. That means to make a pulling effect we will be add the glucose to make this effect in the dialysate. So the diffusion is over and the next one is osmosis. Another principle, it is ultrafiltration. Ultrafiltration, it is the ultrafiltration result when there is an osmotic gradient or a pressure gradient across the membrane. Across the membrane we will it is a result when there is an osmotic gradient or a pressure gradient across the membrane. Here the peritoneal dialysis, the excess fluid is removed by increasing the osmolality of the dialysate with addition of the glucose. In the case of hemodialysis, we will be create a pressure in the blood compartment or decrease the pressure in the dialysate compartment. That is a positive and negative pressure. That is ultrafiltration. In the case of peritoneal dialysis, we will be increasing the osmolality of the dialysate which we used. And in the case of hemodialysis, the gradient which is increased by increasing the pressure in the blood compartment. We will be increasing the pressure in the blood compartment. And in the case of a dialysate, in case how we make a negative pressure means we will decreasing the pressure in the dialysate compartment. will increase the pressure in the blood compartment and decrease the pressure in the dialysis compartment. So through this we will make a negative pressure, and this is called ultrafiltration. Here the extracellular fluid, it will be moves into the dialysis because of the pressure gradient. So there is a pressure differences we already discussed. So the extracellular fluid, it will be move according to the pressure. This is the main principle. Through this the excess or the fluid that will be excess fluid is removed by creating a pressure difference between the blood and dialysis solution. In combination of positive pressure in the blood compartment or a negative pressure in the dialysis compartment, through this pressure difference the fluid will be moves. Through this pressure difference the fluid will be moves.